Welcome to the MD Edge Daily News for Tuesday, July 17th. I'm Nick Andrews.
And I'm Mary Ellen Schneider. Today, overdoses involving fentanyl analogs are on the rise.
Also today, a new device impresses for chronic cluster headache attacks.
Later today, the immunogenicity of 2-dose Gardasil 9 persists at 36 months.
But we begin today with an analysis that finds inappropriate prescribing of antibiotics is being fueled by urgent care and retail clinics. The finding comes from a review of commercial insurance claims published in JAMA Internal Medicine. Antibiotic prescription rates were at least twice as high in urgent care or retail clinics compared with emergency departments and medical offices. The findings suggest a need for antibiotic stewardship interventions to reduce unnecessary prescribing of antibiotics. The researchers included encounters in which medical and prescription coverage data were captured. This included about 2.7 million urgent care center visits, 58,000 retail clinic visits, nearly 5 million emergency department visits, and about 150 million medical office visits. Prescriptions were linked to more than 35% of both urgent care and retail clinic visits. This is compared to about 14% of ED visits and about 7% of medical office visits. For respiratory diagnoses where antibiotics would be inappropriate, they were prescribed in more than 45% of urgent care visits. That compared with about 25% of ED visits and 17% of medical office visits. Danielle Palms is a researcher for the Centers of Disease Control and Prevention. Ms. Palms says that the findings suggest that unnecessary antibiotic prescribing in an outpatient setting may be higher than the previous estimate of 30%.
The number of opioid overdose deaths that involved fentanyl analogs nearly doubled from the second half of 2016 to the first half of 2017. This is according to preliminary data from 10 U.S. states. There were 764 overdose deaths in the second half of 2016 that tested positive for any fentanyl analog. Carfentanil accounted for 421 of those deaths. In the first half of 2017, the total overdose deaths surpassed 1,500, and the number of carfentanil deaths passed 800. Dr. Julie O'Donnell is a researcher at the National Center for Injury Prevention Control at the CDC. Dr. O'Donnell says that the increasing array of fentanyl analogs highlights the need to build testing capabilities to identify and report emerging threats, as well as to enhance capacity to rapidly respond to emerging drug trends. Among the 10 states that reported data, more deaths occurred in Ohio than anywhere else. Of the 421 carfentanil overdose deaths in the second half of 2016, nearly 400 occurred in Ohio.
Sphenopalatine ganglion stimulation via an implanted miniature neuromodulation device has the potential to be a breakthrough non-pharmacological therapy for acute episodes of chronic cluster headache. This is according to the results of a sham-controlled pathway CH2 study presented at the annual meeting of the American Headache Society in San Francisco. Self-administered sphenopalatine ganglion, or SPG for short, that uses a wireless handheld controller resulted in more than a two-fold greater likelihood of pain relief within 15 minutes without the patient resorting to acute medications. This is compared with sham stimulation. The device also led to a significant reduction in cluster headache frequency over time. Dr. David Doddick says that he and his team presume that this is due to its neuromodulator effects. Dr. Doddick is a professor of neurology at the Mayo Clinic in Scottsdale, Arizona. He also notes that he was surprised that there weren't more adverse events with the device. The researchers report that the system was well tolerated overall and that common treatment-related adverse events included numbness, swelling, pain, bruising, and paresthesia secondary to the surgical procedure. The 93 participants in the study had a mean 8-year history of chronic cluster headaches. During the 4-week baseline assessment period, they averaged roughly 11 cluster attacks per week. All patients underwent surgical insertion of the miniature ATI neurostimulator through a small incision in the upper gum. The device was placed deep in the face adjacent to the SPG nerve bundle. Patients were taught to activate the neurostimulator by placing a handheld controller on the side of the face near the implanted device when a cluster headache attack struck. 46% of SPG stimulators were able to attain pain relief within 15 minutes for 75% or more of their attacks. Over half of the active treatment group maintained pain relief for at least 60 minutes, compared with just 5% of the control group. The ATI SPG microstimulator system is investigational in the United States. The system is approved by European authorities for acute treatment of cluster headaches and refractory disabling migraine.
And finally today, robust human papillomavirus antibody responses persist through 36 months in boys and girls who received 2 doses of the 9-valent HPV vaccine known as Gardasil 9 between the ages of 9 and 14 years. This is according to results from an open-label randomized immunogenicity study conducted in 15 countries and presented at the annual meeting of the European Society for Pediatric Infectious Diseases. This is reassuring news supportive of recent regulatory decisions to license the more convenient 2-dose schedule in the United States, the European Union, Canada, and other countries. HPV type-specific antibody levels at 36 months post-vaccination in boys and girls who received 2 doses were similar to or greater than adolescent and young adult females who received 3 doses at ages 16 to 26. While the demonstration of persistent immunogenicity over 3 years of follow-up was reassuring overall, there was a potential hitch. Significantly lower antibody levels for some HPV types were observed in girls who received 2 doses of the vaccine than in those who got 3 doses. Specifically, levels of anti-HPV antibodies to HPV types 18, 31, 45, and 52 were significantly lower in the girls who got 2 doses of the vaccine than in those who got 3. And that concludes the MD Edge Daily News for Tuesday. You can find links to these stories in the podcast description. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. You can subscribe to the MD Edge Daily News wherever podcasts are found.